This is a relatively short video discussing Chapter 13, which is on health policy. And this chapter begins by really just getting into what do we mean when we use the term health policy? What is the definition? So they present kind of like the most common, perceived definition, which is the institutional and structural arrangements by which healthcare is delivered. And as the textbook notes, this can differ greatly between countries. One of the primary distinctions that can exist between countries is whether or not healthcare is part of the public sector, the private sector, or a mix of the two. Another definition, maybe one that people are less likely to think of, is that health policy can be defined as the acts and the pieces of legislation, passed by a governmental body related to health and healthcare. The textbook goes with the Ham interpretation of the Easton definition of health policy. And so Easton defined health policy as being the web of decisions and actions that are concerned with the allocation of values. And Ham further emphasizes certain elements of that definition. That the study of policy requires a study of the actions that flow from a decision concerning policy. Policy is rarely contained in just one piece of policy. Policy is never static and it's subject to change. What is not decided on and not done can be just as important as what is decided on / done. And sometimes actions need to be studied when no decision has been made. So health policy is larger than even the policies that actually get passed and get implemented if we go with the Ham interpretation. And so beyond the kind of complicated definition, the other reason why health policy can be kind of complicated to study is it's not as transparent as it could be and ideally should be. We don't necessarily know like what goes on, behind closed doors in legislative bodies, especially in terms of like the policies, the decisions that, aren't considered, the decisions that aren't implemented. We can imagine, what's influencing that decision making. But as your textbook notes, a lot of those older models related to implementing health policy, they emphasize, perhaps overemphasized, rational step-by-step approach to policy construction. And the authors note correctly, I feel, that these old models probably don't work that well to explain how health policy is being made in modern societies. And they go through several factors that they feel like influence health policy in modern societies. They discuss political ideology, which is probably the one factor that they spend the most time on and expand. So we'll discuss it in a little more detail in upcoming slides. They talk about economics, that there are always going to be some limitations about what can we afford to do, what are the costs associated with this policy. And they said that, this is, this concern with costs, can be is intriguing at least partially because there isn't like a clear relationship, a clear, simple correlation between healthcare expenditure and health outcomes. So it's not as simple as saying if you spend more money, the people in your country will have better health, better, longer life expectancy, lower mortality rates. Like that relationship statistically, doesn't show itself to be true. And really, you can just kind of look to our own country. The U.S. is a good example of this. We spend more money on healthcare than a lot of other countries, but yet, we don't have, the highest life expectancy. We don't have, the lowest mortality rates. We do have, all these issues related to chronic illnesses in particular. And if you were just looking at healthcare expenditures, the money being spent, you would assume we're spending so much money, that must mean that we are one of the healthiest nations, and that's just not the case. The textbook also identifies culture and history as influencing health policy. And when they discuss this, they contrast the conflict around the Affordable Care Act, where for some people who opposed it solely on ideological grounds, the idea, that the government was overstepping its bounds, that they should not be able to force people, to have health insurance, that a person's health and healthcare should be a totally individuated decision. They contrasted that with how Nordic countries, view their socialized healthcare policies, and why they are in general, okay with policies that emphasize, the collective and the community, as opposed to the United States, where there's often this push for individualism and individual liberties. They discuss, the impact that events can have on specific health policies. And, with events, this can range from, a crisis in the healthcare system, a scandal, which is kind of what they focused on with an example from the UK, to the appearance of a new epidemic. Obviously this textbook was written, before COVID-19 happened, but you can certainly think about how in the upcoming years, more than likely, this experience that we're all having with this pandemic is probably going to influence some health policies moving forward. It's certainly influencing some health related policies here in the here and now. And then finally, interest groups, right? So we know that we have special interest groups. They donate to political parties, they donate to specific politicians, and they do this to influence the legislation that's passed. And so all of these things impact health policy. If we specifically look at the role of political ideology, because policy is passed by politicians, the types of policies that they consider, the types of policies that they pass, they also have to kind of consider how do those policies align with the stances of their political party, and the political ideology that they promote. And political ideology, as they note, can be broken down into two broad categories. You can have collectivist ideologies or individualist ideologies. And so collectivist ideologies is, your book talks about it in context to health, but this is understood by the idea that people should pull together, they should share the cost of providing health care, usually through taxation, and that the government should be the one responsible for spending that money in funding the institutional arrangements of its citizens' health, and because the focus is on what is best for the collective. The individualist approach is understood as, the individual should take responsibility for their own health care, or lack of health care, and that this is going to largely be handled in the kind of private sector through private insurance. And so, this was certainly the case in America pre-ACA, and to a certain extent, there is still a very strong individualist approach in how America as a country addresses healthcare outside of programs like Medicaid and Medicare. So although there are many political ideologies that fall under those broad, those two broad categories, the textbook focuses solely on neoliberalism. And that's because it's probably the most dominant political ideology in a lot of countries, at this point in history. And so the central idea behind neoliberalism is that the free market offers the best mechanism to provide all that we need and desire in the most cost-effective way. And this would include healthcare. And the reason why people believe that, the market will ultimately be the best and the most cost-effective way is because it's, the expectation that people will be in competition with one another, providers will and companies will be in competition with one another, and they will seek to have advantages over their competitors in order to gain a greater market share and make more profits. And so in this way, if there is little government intervention, by the magics of the market, we will supposedly wind up with like better goods, better products, and better services. And that's kind of how it's thought of at the macro level. As your textbook notes, some people also apply the neoliberal ideology at the micro level, where they think about individuals as being like both entrepreneurs and consumers, and therefore embodying the ideas of the marketplace in their own behavior, by searching out the best deals, by taking care of themselves, by trying to position themselves, to be competitive with other people for, resources and privileges. And so, just kind of know that neoliberalist ideology, it can operate on both kind of the macro as well as the micro level in society. And at that micro level, your textbook, describes it as being entrepreneurs of their own health, which I felt like was a pretty catchy way to sum up that idea. So, your textbook definitely, this is just but one ideology, just because it's the kind of predominant one in a lot of circles in America. Certainly doesn't mean that that's the case in other countries. And certainly doesn't mean that there aren't people pushing back against this ideology, even here in the United States. And your textbook does offer, they indicate that there is a broad range of criticisms that are directed towards neoliberalism, and they kind of touch on a few of those. So then the textbook raises what I feel like is a very interesting question. Should health policy always be about health? And if we were in class, this is the type of question that I would like for us to ask and talk about and discuss as a group. But we are not in class, we are in a virtual setting. So all I can say is that while this is an interesting question to consider, but in an American context, like what does that look, how would this look like? How would this look? What would this look like in America? I'm less interested in you knowing how the UK has addressed this question. So I am not requiring you to know the 5 waves of public health in the UK. But, just thinking about, does health policy always need to be about health? You can look at a global organization like the World Health Organization, and how Marmot, who is the chair of the Commission on Social Determinants of Health, if you look at the policy recommendations he made to the organization: improve daily living conditions, tackle the inequitable distribution of power, money, and resources, measure and understand the problem, and assess the impact of action. You'll note that none of those look like they are specifically health related, but hopefully at this point of the semester, you're starting to see that, our health is influenced by and intersects with and influences all these other sectors of our life. And that particularly social inequality can be very influential in shaping and, and in influencing our physical, our mental, and our social well-being. And so Marmot's conclusion that ultimately all policy should be aimed at helping people lead lives that they have reason to value. I really just want you to consider, what does that look like? What could that look like here in America? So that is it. This is a pretty short chapter, and thus this is a pretty short video for chapter 13.